Recording in progress. Recording stopped.
Good morning, honorable members, and welcome to your meeting. I just would like to also greet very warmly, although it's cold, the Department of Planning, Monitoring and Evaluation, who are among us today to brief us on the role in the fight against substance and drug abuse. We welcome you and we thank you so much for coming through and for honoring our invitation in this regard, because as the portfolio committee, we would welcome any information that would shed some light on the situations, on the ills, social ills that the country is faced with, and one of them being the substance and drug abuse. So your presentation will really assist us in the work of oversight that we are doing. So I also want to welcome our department, the Department of Social Development, the Minister and DM and our DG and the senior management that are among us today, and even the agencies or the entities of the department if they are part of this meeting this morning. So you are all welcome. The team in Parliament that supports us and makes this work happen, you are welcome, and thank you for what you are doing. And any other stakeholder, I believe there would be media, and so you are all welcome. Just before we start, though, I would like for us to just observe one moment of silence for prayer and meditation, please. Thank you so much for that. So before we go any further, as I was welcoming all of you, I think not one South African is not concerned about the situation of substance and drug abuse. And I think all of us are looking for any indication of a solution to this problem, because so many South Africans, young and old, are trapped in this very, very cruel situation of drug and substance addiction. So I just would like to hand over to Lindiwe to take us through the very necessary formalities before our meeting is declared valid to go ahead. Over to you, Lindy.
Thank you very much, Chairperson, and good morning to you, Chair, members, Chair, and any department officials and stakeholders, Chair, in attendance. Chair, I will just take the committee through today's agenda. Today is the 11th of June, 2025, and the committee is constituted in terms of the NA rules to perform its constitutional mandate. Chair, you've already welcomed us and explaining the purpose of this meeting. Chair, the members that are in attendance from the Portfolio Committee on Social Development, I have you, Member Masango, as the chairperson of this committee. I have Member Abrahams, I have Member Mahato, I have Member Munyai. I didn't see any member in the platform. Chair, the apologies, I have an apology from Member Marais, who attended, who also indicated that she will join the meeting a bit late. She's traveling. Also, there is another apology from our minister, Uma Mutolashe. She's attending the cabinet minister, and also the DM She's got other prior arrangement, Chair. Also, there's another apology from the Deputy Minister of the Department of Planning, Monitoring and Evaluation, Chair. He is also traveling. He won't be able to attend today's meeting. Also, Chair, I saw Member Ramaila just joined the platform. We'll proceed, Chair, after adopting the apologies to receive, I don't know whether or not the Minister is not here. We're supposed to get an overview by the Minister. Chair, we'll also proceed to receive a briefing from the DPME and on its role in the fight against substance and drug abuse. And then the committee will proceed with its deliberations and receive responses from the department. And then from 11:30 to 11:50, we'll receive the briefing from DSD on the progress made on the redrafting of the Children's Amendment Bill. And then we'll proceed with committee deliberations and receive responses thereafter. Chair, we will move with our internal business to discuss, to consider and adopt our committee report on the oversight conducted in Gauteng sometime in March. And then we'll proceed with the adoption of 2 sets of minutes, the minutes of the 21st and 28th of May, 2025. Thereafter, Chair, from 1 o'clock to 1:10 you will do your closing remarks and then the meeting will adjourn. Thank you very much, Chair. Over to you.
Thank you, Lindiwe. For that, I would like to then table the agenda for adoption, please. I see Honorable Munyai his hand has been up. Honorable Munyai.
No. Yeah, the hand has been up precisely because we tabled a standing apology for Honorable Member Tlo, who has undergone an operation. We request that it must remain until there's a change on that development.
Okay.
And in addition, I'm moving for the adoption of the agenda as presented. Thank you.
Thank you, Honorable Munyai. And we note that that apology for Honorable Tlong, and it will be a standing apology as has been advised until we are advised otherwise. Thank you for that. And also we note your adoption of the agenda. Honorable Mkhatho.
Thank you very much, Chairperson. I second.
Thank you so much, Honorable Mkhatho. The agenda having been adopted and seconded, so we do have a valid agenda to go on with our meeting. I will not take any more of our time, as we know we have the meeting on the other side of this town at ICC. So I will go straight into the agenda and ask, having heard now that the Honorable Minister is not here, or the DM for that matter, I don't know, I will just hand over to the Department of Planning, Monitoring and Evaluation to be advised who is with us this morning, who is leading this, the department's presentation to us, and hand over as such. We will be guided by the department from now on. So it's over to you, Department of Planning, Monitoring and Evaluation. And again, thank you so much for coming through. You are welcome. Is anyone from DPME?
Good morning, Chair, and good morning, members. My name is Stella Masombuga. I am from the Department of Planning, Monitoring and Evaluation in Sector Monitoring, and I am going to be taking the honorable members through the presentation. I am with Dr. Sfiso from the Office of the DG I had thought he was the one who was going to introduce the presentation. Dr. Sfiso, if I may continue.
Recording in progress.
Dr. Ngobo, are you available for us to introduce the briefing from DPME? Please take over. I see the Dr. Ngobo's picture on the screen, so I'm not sure whether it is a technical glitch that is causing him to stay muted and not talking to us. I think until Dr. Ngobo informs us, I will hand straight back to you, Ms. Masombuga, to take us through. Dr. Ngobo can intervene or interject whenever he is available, because I don't see any movement from his side. So if Ms. Masombuga, please go ahead. Thanks.
Thank you very much, Chair. I would also request to be able to project as I'm disabled by the host, or if it is flagged from the committee side. I'm not sure.
I believe you've just been made a co-host.
Okay.
Yeah.
If I could
Thanks.
just share. Okay. Chair, if you could confirm if it's showing.
It is showing. Thanks.
Okay. On a slide mode, Chair.
It is on a slide mode from where I am, yes.
Thank you very much, Chair. Again, colleagues, I am Stella Masombuga from the Department of Planning, Monitoring and Evaluation, and I am going to be making a presentation in terms of the role of Department of Planning, Monitoring and Evaluation in the fight against substance and drug abuse. I am a bit challenged in terms of sharing, in terms of moving the slides. Okay, are they moving now, Chair?
You've actually gone straight back to your screen of your computer, and I can just see if you can go back, and now you can make it to, yeah, I don't know if that is slide mode, but it's back. Yeah.
I'm so sorry, this is just, okay, it's on a slide mode now.
Yes, go ahead.
You see, the thing is, when I put it on a slide mode, then it doesn't really move. But I can.
We as the honorable members receive this presentation, I don't know if members agree that you go ahead off slide mode, because we also have our copies, like we were sent this presentation.
Okay. I sincerely apologize for that. Let me share again.
Can I just ask, Lindy, where is anyone of you who have this presentation? Can anyone help with the flighting for Ms. Masombuga? Lindy, where?
Chair?
Are you able to flight the presentation in such a way that it can move the slides? Because there is an issue with them.
They're moving now from the side. Thank you very much. I sincerely apologize for that.
Not at all. That's technology for you. So go ahead.
Thank you very much, Chair. In terms of the outline of the presentation, we're going to go through the mandate of the DPME, which is the Department of Planning, Monitoring and Evaluation, and also the role of DPME in the value chain of government, and also indicate how how DPME supports the implementation of the government priorities, then getting to the role of DPME into the actual fight of substance and drug abuse, then the implementation evaluation that has been conducted on the 2013-2017 National Drug Master Plan, then also highlighted the DPME monitoring instruments that are used, and the National Evaluation Policy Framework that actually guides, the development of evidence-based, information, so that it supports a policy, it supports programs, it supports even the review of different programs of government. Then lastly, getting into the medium-term development plan, which also carries some of the interventions which are aimed at facilitating the implementation of the National Drug Master Plan. In terms of the mandate, the core functions of DPME, as per the Proclamation 47 of July 2014, it is mandated to institutionalize the long-term planning through the National Development Plan and the medium short-term planning processes. This is done by coordinating and oversight on 5-yearly strategic plans and annual institutional plans, which are then presented and approved by Cabinet, then subsequently Parliament. It also responsible for institutionalizing monitoring, which includes the ongoing tracking of the implementation and the progress of government plans, including the now MTDP, infused into the MTDP by applying robust monitoring systems backed by evidence. These are evidence, obviously, developed from the evaluation that are conducted. Evaluations are done to evaluate critical government programs with the intention to inform planning processes, the monitoring processes, the government interventions, as well as budget prioritization to an extent. In terms of the interventions, DPME also intervenes on behalf of Cabinet and the President for remedial actions, and also on planned or unplanned events, such as the issues of natural disasters and the challenges identified from planning, monitoring, and evaluation processes. Chair, in terms of the DPME in the value chain of government, this is also linked to the previous slide. It is a task with the responsibility, in fact, in terms of our impact statement, is improving the country's developmental outcomes as envisaged in the NDP, and this is done through effective implementation of the government plans, and this time it is the medium-term strategic development plan, which has been previously named as the medium-term strategic framework. Now, the DPME is responsible for, in terms of our outcomes within the current strategic plans, is to improve the governance and capacity of departments, improving a government-wide planning, monitoring, and evaluation, the regular monitoring of progress of the NDP, which will be implemented through the NTDP targets, continuous assessment in the implementation of the NDP and the MTDP, and also the improved utilization of evidence in planning, implementation, monitoring, and evaluating of government priorities. Also, DPME has a responsibility in terms of our strategic plan to engage with relevant stakeholders in departments and the implementation of programs and interventions through the strategic partnerships in relation to the government departments, engagement with civil society, the private sector, and also with regards to the development and refinement of goals as espoused in the MTDP. Now, in terms of how our work is guided or is structured, we are promoting the outcome-based approach, which is what we wish to achieve, and also we're using the outputs in terms of what we produce or deliver, and also we use the activities which are enable us for us to achieve our outputs, and also the inputs, which includes the issues of resources, budget, and any other tools of trade that might be necessary, so that we are enabled to do our work in terms of us achieving our activities, and also resulting in our outputs, which then translate to the outcomes, which outcomes are resultant of the improvement in the state of being in terms of the impact out there in terms of government programs to the society at large. Now, how DPME supports implementation of government priorities? It is through the strengthening of the coordinating structures, the clusters, the implementation forums, and also the agenda setting, coordination and the institutionalization of the government-wide planning, monitoring, and evaluation guidelines and frameworks. We also facilitate integrated planning, monitoring, and reporting, facilitating a coordinated delivery of interventions for corrective action, conducting evaluations, which are informing the baseline in terms of programs, the midterm reviews that we usually conduct, the end-term and thematic issues, also for evidence-based decision-making, policy reviews, and planning. We also communicate and citizen engagement to influence change of values and culture, and this is done through the program within DPME that is frontline monitoring and also citizen-based monitoring, and or other programs that are driven by our leaders in terms of the Izimbizo and the outreach programs. In terms of the actual role of DPME in the fight against substance and drug abuse, we know that as with many other countries, South Africa is also affected by the problem associated with substance and drug abuse. And these are just some of the stats that indicates that about 292 million of people use drugs in the last year, and this is aged between 15 to 64. We also noted that cannabis remained the most used drug worldwide, followed by opioids and the amphetamine type stimulants, cocaine, and ecstasy. Now, locally, South African National Council on Alcoholism and Drug Dependence statistical reports indicate a total of over 80,000 people with a substance use disorder, and these were admitted over the last 8 years at different SANCA facilities. And also the dominating age, it's between 14 and 17-year-old, followed by 18 to 39-year-old. Now, the National Drug Master Plan provides policy direction and coordinates efforts to respond to substance abuse in South Africa through a balanced approach and integrated combination of strategies for demand reduction, supply reduction, and harm reduction. It provides the impetus for various role players to address substance abuse collectively in their communities. Now, different sectors play different roles in responding to these strategies. These strategic priorities, strategies for demand reduction, supply reduction, and harm reduction, as alluded in the above bullet. DPME then uses different frameworks for planning, monitoring, reporting, and evaluation to track progress on key priority areas of government, and the implementation of the National Drug Master Plan, in particular, form part of the 2 previous administration and the current 7 administration, which is being monitored by DPME. In terms of a very brief, in terms of the national evaluation framework, I will not get into details into this. This is how we do our evaluations, DPME is the custodian of the National Evaluation Policy Framework. It oversees the functioning of the National Evaluation System, which comprises of all sectors and instruments contributing to the evaluation practice. We conduct the evaluations, we also commissions them, or we coordinate in order to support evidence-based policy and decision-making. Evaluations in particular contribute to accountability of institutions in the implementation and impact of the programs of government. Now, what we really look at, it's issues of performance, accountability, improving decision-making, and also the generating of knowledge so that we become a learning institution over and over again. The implementation evaluation, which was conducted in the 2013-2017 National Drug Master Plan, this was done in collaboration with the National Department of Social Development, and this is what took place in 2015 and ended in 2016 January. The theory of change that was developed then was that if the system for addressing the multifaceted nature of substance abuse is well coordinated, it is integrated and functioning at policy, program, and administrative level, then the state or agency's capabilities to reduce demand, supply, and harm related dependence will be enhanced and treatment will be improved. The theory of change assume that result will be reduced biopsychosocial and economic impact of substance abuse and the related debility on the South African population. The evaluation in particular found that elements of the system are not working effectively, as the then National Drug Master Plan has not provided sufficient clarity and guidance. There were issues of financial and human resources that were inadequate. The location of the Central Drug Authority within the DSD was also seen as something that hampered the Central Drug Authority's ability to lead, manage, and coordinate the implementation of the plan. Now, the evaluation provided the following policy recommendations, 3 of them, apologies, Chair, to strengthen the autonomy, independence, and authority of the Central Drug Authority. Also a comprehensive review of the National Drug Master Plan to ensure consistency in policy approach to substance abuse, provision for sufficient funding for the Central Drug Authority to commission researches and thereby propose evidence-based policies. Now, the evaluation findings of that the 2013-17 plan has came up with the recommendations which has informed the review and the development of the current plan that we are implementing, the 2019-2024. And we are saying here, to an extent, most of the recommendations have actually been taken into consideration in the current plan that we are implementing. Safe to indicate that just one example is that the Central Drug Authority was then established as a statutory institution, which has had its autonomy and its independence in terms of monitoring the implementation of the plan. The monitoring instruments that are used within DPME as part of facilitating different interventions and supporting the implementation of different programs. We have the quarterly reporting system, which all institutions are required to report into. And these are also reports that fits into the biannual reporting. The biannual reporting process becomes the subject of cabinet. We also have project monitoring and verifications, which are to physical visit to different projects and programs that are reported so as to ensure that what is on the ground actually correlates with what has been reported. We also have evaluation and research reports as indicated. The frontline monitoring support goes into the ground. This is a program that is mainly tasked with the responsibility of assessing the views of citizens on how they experience government programs. Ministerial performance agreements, these are agreements that are signed based on the government plan with different ministers coordinated by the president, and DPME also assist in this process. We also develop the midterm reviews and the end-term reviews, which give a holistic view in terms of how government is performing in terms of implementing their programs. Now, the last part is the follow-ups that are done on different cabinet decisions, so that there are consequences management. There are also follow-ups where cabinet directed that some of the issues needed to be implemented. DPME also follows up in terms of that. Now, the findings They are mainly used to improve the accountability and transparency, to enhance the performance of institutions, programs, and projects, to support decision-making, most importantly, and also to increase the use of evidence to improve the quality of policies, the plans, and implementation of programs, and again, to generate the knowledge about what works and what does not work for wider application. This should also result in increased learning between and within organizations, as DPME is working with different organizations. Now, the MTSF, the MTSF is the previous plan of the previous administration. Is just to indicate some of the indicators that were derived from the National Drug Master Plan. It was the support programs aimed at reaching out service users, receiving the reintegration and aftercare services for substance abuse, which have been implemented. In the previous closeout report, we noted that there are 9 provincial substance abuse forums that have been established, and the plan is also implemented separately in each province. This is what we have noted. As at March 2024, over 25,000 victims of substance abuse access support programs, about 33 million people were reached through prevention programs from 2019 to 2024. However, we note that substance abuse cannot be dealt with in isolation, as it is also linked with other social ills and chronic diseases. We also note that the provision of services is still fragmented as it stands, and this is an area that might require a further improvement. The inadequate resourcing to enable the effective implementation of the plan, which requires the coordination, monitoring, and the promotion of the multi-sectoral approach in substance abuse, as it is viewed as, a whole of society, a problem. The National Drug Master Plan, in terms of its policy direction, whilst it is trusted on 3 pillars of harm reduction, demand reduction, and supply reduction, it is criticized for being short on detail around the implementation, as alluded in the previous slide, and that it assumes that policy and direction set at national level will filter down to provinces. However, we have noted that each provincial department can define its own strategies and produce its own legislation. Hence, the key lesson is that the integration of the National Drug Master Plan goals and objectives into departmental planning frameworks does not necessarily guarantee that they will filter down into provincial level departmental plans. The medium-term development plan, which is the current plan now in terms of where we are as DPME, it is implemented through the 3 strategic priorities, and it is managed and coordinated at national level. However, reporting is disaggregated according to provincial and local level to track the outcomes and impact with periodic monitoring reports. And then in terms of the National Drug Master Plan, it forms part of the strategic priority 2 in terms of the outcome of optimized social protection and coverage with regards to strengthening the implementation of the plan to ensure South Africa is free of substance abuse. It also features in strategic priority 3 under safer communities and increase business confidence. Now, this is where we continue with the implementation, we're tracking the implementation of the National Drug Master Plan in the current plan. In terms of the JCPS cluster, it has developed a comprehensive approach to address the full spectrum of the drug supply chain, ranging from illicit cultivation, production, trafficking, drug couriers, and drug outlets, and emerging threats through the National Drug Master Plan. And this is monitored and progress is reported through the MTDP, the DPME MTDP biannual reporting process. DPME is currently participating in the review of the current National Drug Master Plan for the 2025-2030 National Drug Master Plan, which will maintain the strategic goals established under the current Drug Master Plan, operationalizing them through better resource alignment, data-driven programming, and stronger partnership. The plan for the next Drug Master Plan 2025 to 2030 is positioned to continue South Africa's commitment to a public health, development, and human rights-oriented response to substance abuse. And Chair, I think here we are just indicating one of the headline story that hit the headlines in 2007, just to indicate, the impact of the substance and drug abuse, especially on society, which, one needs to look at a family level, a community level, and at the societal level, where we have seen that, the mother, took her life, and also she took the life of her son in 2007, just, relating to the issue of substance and drug abuse, and also the issue of gender-based violence. We've noted that some of the issues that are permeating the space, fueling the issue of GBV, it's somehow related to the issue of substance and drug abuse. And Chair, I will end this presentation with that. And thank you very much, Chairperson, members, and colleagues.
Thank you, Ms. Masomboga, for your presentation. If you can just remove the presentation so that we can go back. Thank you so much. Thank you for the presentation, which hones in directly to the role of DPME in as far as the substance and drug abuse, strategy in this country is concerned. And also what struck me very, very, what can I say, very clearly was the fact that you are tracking the progress of the work that is being done by the various stakeholders in the sector. And so your briefing or your presentation would be as strong or as not so strong as the information that you get on the ground. This is very helpful in understanding, what each stakeholder and what each department is there to do in this very, very concerning situation that we are faced with in this country, in as far as the substance and drug abuse is concerned. I will not ask my questions yet, because I want to give the members of the portfolio committee to ask their questions first and make their comments first, so that we can get some responses from yourself and your colleagues that you've brought with to respond. I see that the members of the portfolio committee have already raised their hands in the persons of the Honorable Munyai, the Honorable Abrams, and Abrams. I don't see anyone else yet. Oh, there is the Honorable Kwabaza, and that seems to be the only three members. So your presentation must have been quite clear and to the point as far as that is concerned. I see that the Honorable Mare has also joined. You are welcome, Honorable Mare, and I note your hand as well. Let me go straight to the Honorable Munyai. Go ahead, please, sir.
Thank you, Honorable Chairperson and honorable members. Firstly, let us welcome the presentation. I know in the DPME, their presentation are long presentation. I don't know whether because they are in the presidency, they have usually a long presentation, but nonetheless, let's welcome it. The key area that I want to raise with regard to the consumption of cannabis as a prevalent as they would have flagged it is and of course they mention other types of drugs and so on. And I think they might be aware of the Justice Zondo ruling, which allows people to consume cannabis. And we further have to use health within the context of SAPRA to regulate the TCH that is within those cannabis, such that they must be at a level that doesn't cause harm. But as you know it, that ruling made a massive consumptions of the cannabis in the public, in the private spaces, in the biggest way. It made it practically impossible for police themselves even to assist with that regard. But in the context of separation of power, what can we do? Is the nature of the beast. Let me come to the issues of the CDA. Look, the mandate of the CDA is very clear, and it's located within the Department of Social Development. So that is one of the key programs that really strengthen the ability of the Department of Social Development to respond, to these people that are affected by drug abuse and so on, and proactively make necessary awareness. We know, we must put it straight here before this portfolio committee, that from the onset, upon appointment, the CDA, most prominent, popular two members of the board, has been parading across the countries and so on. Firstly, wanting that it must become an independent Section 3A. And we made a decision of the portfolio committee, and we know that it will be effective not as an independent structure, but as part of the key pillar within the Department of Social Development. They themselves, they thought if they're independent, they'll get more money, they'll be paid more, since they believe that for the fact that they're advancing a program within the Department of Social Development, it will not make them receive sufficient funds that they've raised. And I think we clarified some of the rules. They are not police officers that are dealing with narcotics and so forth and so on. They are dealing with the program of social development, which inter alia must become, which is cross-cutting other departments and must be able to be supported in that regard. So the decision that we have taken that, and I think I still stand by it, that we believe the program must remain within the social development. It's part of the comprehensive integrated program of programs of really dealing with the substance and drugs abuse outside the issues of enforcement. That's the point that I wanted to put forward. And the other key issues that we must say that because if the program is out, it will not be better, because there are many programs. If you are to look all the programs within social development and look how how the CDA fits for purpose within the comprehensive strategy of the department, you will understand its importance and its location in that regard. Other than that, I must welcome the presentation and the area that have been flagged that requires attention by DSD in general. Thank you. And lastly, Chair, the issue of the areas of weaknesses that have been drawn up with respect to the strategy, and I'm sure it's something that can be attended going forward. Thank you very much.
Thank you, Honorable Minyai, for your comments. I just would like to now go over to the Honorable Abrams. Thanks.
Thank you very much, Chairperson, and good morning to all the members and other officials on the platform. And thank you very much for that high-level presentation from DPME. Chairperson, my questions are as follows. I'd like to know how frequently does DPE meet with DSD? And is the frequency the same as DPME would meet with any other department or entity? I'd also like to know if your frameworks, your M&E frameworks and others extend to provinces and municipalities, or do you solely focus on the national departments and entities alone? I would also like to know, does DPME have access to DSD's electronic M&E system? So yeah, because it's my understanding that obviously it's an electronic system, something that can be accessed across, that might be useful to be accessed across, other departments. So just like to understand if you make use of that, of DSD's M&E system. Then, Chairperson, on the one slide that speaks to the evaluation of the 2013 to 2017 National Drug Master Plan. Obviously, I'm assuming that this is the most recent evaluation that has been done, and therefore I'd like to know, when will the evaluation of the 2019-2024 NDMP be commissioned? So when will that be commissioned? And then, Chairperson, on that very same slide, it speaks to the findings on that evaluation. And one of the findings, speak to the funding of the CDA. And just like the honourable member before me, we constantly talk about the funding of the CDA or the lack thereof. And I mean, this now looks like it's an evaluation that started in 2015. And thus, 10 years later, we are still talking about, insufficient funding for the CDA. And it leads me to a question then, Chairperson, one that we also and the department needs to evaluate, and that is the effectiveness of the CDA. And so my question to DPME is, do they view the CDA as being effective in their role? And on that same presentation, it speaks to the authority of the CDA. One of the findings were that, it lacks authority, the CDA. And that's also something that we've, been discussing as a committee. And, one of the recommendations were that, we had to amend the Prevention and Treatment of Substance Abuse Act to, give the CDA more teeth and so forth and so on. But that is also long outstanding. So it brings me to a question that if the DPME has, all these M&E and reporting and accountability frameworks that they use, what happens if DSD or an entity or, official fails to meet a deadline or submit a report within now all your frameworks? Does DPME have, the authority to implement consequence management over DSD officials who, just don't submit reports and so forth, or CDA that, we also know had a challenge with submitting their reports at a time? And what gives then DPME's frameworks teeth that, all these structures actually adhere to your deadlines, to what you're trying to achieve? Because we know that if something is late, if a report or something is late to be submitted, it has a ripple effect, in further developments in the department. So, yes, so what gives DPME their teeth to actually exercise accountability over DSD and its entities? I think that is all my questions, Chairperson. Thank you.
Thank you, Honourable Abrams, for those questions. I would like to now go over to the Honourable Reverend Kobaza. Thanks, Honorable Rev.
Thank you so much, Honorable Chairperson. Honorable members, I'd like to greet you all this morning. Chairperson, the concern that we have, it will be the concern of the impact of all these entities and bills and everything. You know, I have a challenge of looking at the impact itself in terms of last year. Maybe we look at last year in terms of the drug abuse and how have we assisted the people that are the victims of this last year, the year before, and all of that, because each and every day or each and every year we have increase of these, and we have all these beautiful strategies that comes in, and we put budgets on these things, and at the end of the day, the impact at the back end, it does not match the strategy which was presented and which was good. At the end of the day, you'll find that people are still in drugs, people are still being victimized, your GBV enters into that thing. So I'm just trying, maybe the question will be then, what is the impact that have happened in terms of the decrease maybe of all these challenges that we are facing in the space of the drug abuse, and is there anything that out of the strategies that are there we can say we have made an impact on this, a positive impact on this, because each and every year we have the increase of all these challenges that we are facing in the space of the drug abuse. Thank you so much.
Thank you, Honorable Tobaza, for that question, those questions. I will now go over to the Honorable Tagudin. I don't see Honorable Mare anymore, and she would be the one asking her questions now. So, Honorable Mare, if you join us again, you will just indicate by raising your hand again. Honorable Tagudin.
Good morning, Chair. Good morning, colleagues, stakeholders. Chair, I just have two questions. I'd just like to know, what role does DPM play in the tracking substance abuse prevention, if it's in schools, in high-risk area schools? And then also, are there any plans to strengthen the integration of substance abuse education into school curriculums at primary and secondary level? Thank you, Chair.
Thank you, Honorable Tagudin. Honorable Murray is back. You are welcome, and please go ahead, Honorable Murray.
Good morning, Chairperson. Good morning to all the portfolio members and all the. And I just want to say and thank you for the presentation to the department, Chairperson. What was very alarming for me when I saw they used the name of the lady that killed her son, Alan Pakis. And it is a movie, and we all know the movie, the Alan Pakis. My problem that I have, Chairperson, is that, the drug abuse in our communities is very high. Every year we come and we present these nice plans that we're going to put in place, but it never takes place because you don't see the thing is actually happening on the ground. And that is my problem. You can have all these fancy words and you have all these fancy programs, but as long as we don't see the change on the ground, that is the problem. And I want to know, what are you going to do to make it, to ensure, not just on paper, because I know the 5 years is coming to an end for the board members. What are we going to do impactful? Because for me, CDA, he doesn't do anything You know, CDA is just there, boards coming together, having nice discussions, but nothing is happening on the ground because you still see children are dying of drugs. That lady, Ellen Pakis, she killed her own son. She stays in Lavender Hill. She kills her own son because the way he was abusing her and her husband. The way these drug addicts are abusing their parents on a daily basis. It is torture. And as long as these people are going to come to the ground and see exactly what is going on, it's going to be a problem. Every 5 years, every time they change the board members, the new ones come in with more fancy things, but nothing is happening on the ground. The same with the dacha, what Munai was saying, is that you get the edibles that is contained of dacha. No? And then dacha has been sold in shops like streets, and I keep on talking about this. And I'm having a huge problem with that because children can get these things and you go on a high. And you won't even know what is happening to you. That is where the rape and the abuses is coming in. So to have all these presentations, have all these master plans, but CDA is not doing what they're supposed to do because they are not reaching the communities. The same with the municipalities. They're supposed to have this officers in the municipalities on a level on the ground, but it is not happening. And while it is not happening, I can't see what difference is CDA going to make. Chair. Thank you so much.
Thank you, Honorable Mare. I get you there. And I actually get what all the members of the portfolio committee have said. For my questions, I see that the Honorable Tafeni has also joined and has raised her hand. I think I will ask you, Honorable Tafeni, to go ahead first before I ask my questions. Over to you, ma'am.
Oh, thank you, Chair. And Bulise members officials. Ndixolise kudala nditry ukungena. I don't know ukuthi network yami yenza njani. Chairperson, in the evaluation, in the planning and monitoring and evaluation presentation, in your presentation, you did outline that you work based on research and proven data. And my question will largely be based on testing that aspect so far as substance and drug abuse in concern. Having said that, does the department have statistics with regards to where drug abuse is most prevalent in South Africa? If so, please furnish us with leading provinces and the number of people affected. And also, what intervention have this department initiated to eradicate drug abuse and assist drug users to rehabilitate? And secondly, what collaboration does the department have with the South African Police Services, and whether this department has embarked on any program in collaboration with SAPS to shut down drug houses, especially in provinces such as Western Cape? And also, what initiative does the department have to rehabilitate and assist homeless people against drug use and the use of needles on their bodies that are thrown all over the place and pose a danger to children? Please share your success stories so far as a fight against substances and drug abuse is concerned, and state what has the department achieved. I want to thank you, Chairperson.
Thank you, Honorable Tafeni, for that. My questions are really coming out of mostly, I think I've been covered by the colleagues, but my questions come straight out of a slide of your presentation, Ms. Masombuga, that I realize that the slides are not numbered as well. But there is a slide where you talk to us about the implementation evaluation. And right towards the end of that page, of that slide, you provide us with the recommendations of the evaluation, notably for me at least. Well, overall, I just would like to know which of those recommendations have been, I think you did mention that some of them have been implemented or something to that effect, but I would like for us to go back to that when you respond. Because, I mean, we had the CDA come to present to us, and they said word for word what I see on this slide, where it talks about the fact that the financial and human resources are inadequate and the location of the CDA within the DSD hampers their ability to lead, manage, and coordinate. Because I guess they are guided by obviously what it is that you can do, what it is you cannot do in terms of protocols, in terms of policies, and so on and so forth. And also, then it goes right through to say that the recommendations are to strengthen the autonomy, independence, and authority of the CDA, comprehensive review of the National Drug Master Plan, and then provision for sufficient funding for the CDA. Because my thinking about this, as it has just been an issue for me, that if you have an organization such as the CDA, where you are calling it an authority, but it's tucked away into a subdirectorate, or I don't know where it really is. So you are expecting, according to the status, you say this is a central drug authority, which is a mandate, a very clear mandate. It has to work with the department. It has to work with the provincial drug master plan implementers, and even at a local level. But when it comes to what this slide is saying, when it comes to autonomy, when it comes to independence, when it comes to funding, then that is all that matches the name or the status of authority. I need to be clarified as to how far have these recommendations been considered, and what can one expect? Because I do also am very mindful that the evaluation were for the 2019-2024 National Drug Master Plan, but surely one can expect what has happened, what is happening, and what will happen as a result of those recommendations. I know they are recommendations, they are not like law, but obviously they come out of a very rigorous, as far as I can understand, process of evaluating, monitoring, and doing all the things that you outlined to us that the DPME is doing with departments and entities that it works with. So that is where I will just restrict my question and a request for clarity in as far as your presentation today has happened. So I don't see any other hand from the honorable members. So I will hand straight back to you, Ms. Masombuga, or whomever else that you have coordinated to take us through the responses to your presentation or to the questions and comments that the honorable members have raised. Thank you so much for that. You can take over, ma'am.
Thank you very much, Chair, and thank you very much from the honourable members in terms of the comments and the questions. I'm not sure if I should respond to this. Maybe let me start by each comment or question raised by each member, if the Chair allows. The first one, in terms of the location of the CDA and the advice that had been given previously, I think we note that, and as I had indicated, that DPME is currently working with the Department of Social Development in the review of the current one in preparation for the 2025-2030. So I think the strong advice in terms of the location of CDA will be noted as such, and I also saying this in cognizance of my DSD colleagues that are also on the call. There was also questions from Honorable Member Abrahams in terms of how frequent do we meet with the DSD. I think here the question, the direct answer would be based on the structured frameworks. We would meet on quarterly basis, not only on the subject matter, but as part of processing reports to Cabinet in terms of the implementation of the 5-year plan, which would be inclusive of the draft master plan. But also we meet on issue-based, though we are structured to meet on quarterly basis, but as and when there are issues that requires us to meet, we do meet, Honorable Member. In terms of our M&E frameworks, whether they do cascade to provinces and local levels, yes, I think when I started mentioning the mandate of DPME, our main role is to institutionalize the planning, monitoring, and the evaluation frameworks. And this institutionalization is guided by the government-wide M&E policy framework that was adopted in 2017. And that framework, clearly states that the institutionalization needs to happen across a government-wide level, which includes provinces and municipalities. In terms of if DPME has access to DSD M&E system, I think the direct answer would be no at this point in time, because we are currently relying on the reports that are provided. But I think this is something that could be considered in the future. There was also a question: when is the evaluation? When is the current evaluation to be commissioned? I also note that perhaps because I'm not sure when if the member joined when I had started to indicate that the review it's definitely to do that. And in terms of the commission of the actual evaluation, I wouldn't really know. It will be a process that will follow up from that review. If indeed we'll have to do another evaluation, or we'll just take the results of the review and inform the current one that we that will be 2025-2030. In terms of the funding, okay, there was also a question in terms of the funding of the city, if we feel that as DPME that it is sufficiently funded. On this one, I think the main approach of dealing with the substance and drug abuse is trusted on the multi-sector approach. And the multi-sector approach requires, both government, civil society, and business to come on board. And if we haven't really strengthened that, government alone, I think we are aware that we've got limited resources. Now, the multi-sector approach would then assist in maximizing the resources, because not everything would then have to be done by government. What we do in terms of our role in terms of consequences and all of that, DPME's role, we report and recommend to Cabinet, and then we also follow up on Cabinet decisions. And in terms of whether I think there was a question in terms of what is our strength, what is our do we have teeth, in terms of this. I can safely indicate that what we found, and as either good or not good, and also issues that requires escalation, we report and recommend on what needs to be done to cabinet, and based on the feedback and the advice from cabinet, then we do implement such decisions and advice. And also from Honorable Reverend Gwabaza, I will respond to the question and the comment together with the question or comment from Honorable Marais that in terms of the impact of all the entities, or in terms of the impact of whatever programs that are done, a straight answer would be a research or an evaluation that is evidence-based, because it really means that whilst we are implementing whatever we had agreed on, whatever has been identified as very much relevant interventions, if they are not really yielding the results, then it means we'll have to look back at our theory of change. Either in our theory of change, something is not really right, and then because we are implementing whatever we're implementing based on the theory of change, which was based on the fact that if all hands are on deck, then ABCD will change. But if that is not really happening, it then requires another scientific process of generating evidence in terms of what is not working, what could be other contributing elements or causal effects that are really working against the interventions that we are implementing. Then in terms of the question from Honorable Takodin, in terms of the role of schools and the integration of the drug curriculum, drug into the school curriculum, I would not have a direct answer for now, but what I can indicate, if it's allowed, this I can find out and maybe give a response. But what I know is that the Department of Basic Education also has a role, which I can't really remember explicitly right now, and with a fear of misinforming the members, I know that there's a specific mandate and responsibility that is assigned to DPME in terms of curbing the issue of substance and drug abuse. Then the last one from Honorable Tafeni, it's asking if departments have got steps in place in terms of the highest use in terms of drugs and so on. And we do not have a DPME owned database. We rely on databases from other institutions, including the Stats SA, and that information could be made available if members would want to see the trends in terms of the province consumption and the national state.
Ms. Masomboga, are you still with us? Honorable members, I don't know whether the connection issues have taken over here, because if you can hear Ms. Masomboga, please let me know, because I can't. Honorable members, can you hear Ms. Masomboga?
Can't hear her either, Chairperson.
Okay. So, Ms. Masomboga, is there anyone else from the Department of Monitoring and Evaluation that is on the platform that can take over from where Ms. Masomboga was, just to complete the responses to honorable members' questions and comments, please? Okay, there is nothing to that. Ms. Masomboga, are you back with us? Oh, there is a hand of Dr. Ngobo. Please go ahead, sir.
Greetings, Chair. Greetings, honorable members. I'm Swiso Ngobo in the Office of the Director General. My attendance was to support the actually colleagues. I have heard the actual questions, but we were expecting other colleagues to join, be able to respond to the posed questions. But we will request to the honorable members, if there are questions that are not fully answered by us, we be given time to then forward the actual questions either in writing, or maybe we be recalled to another PCM meeting where the DG and other colleagues will be able to actually join. The DG was supposed to come in, but there was an agent for such meetings also that was actually called in. You know, we do apologize if there was any misrepresentation and inconvenience caused to this honorable house. Thank you very much, Chair.
Thank you, Dr. Ngobo. I see that Ms. Masomboga is back with us. So yeah. So Ms. Masomboga, you can wrap up. I'm sure you had connection problems there. Go ahead, Ms. Masomboga. We cannot hear you. We can see your mouth moving, but we can't hear you at all. Please check all your volumes. No, we can't hear you still. I think we will take the offer made by Dr. Ngobo of having the very few, if not a couple of questions that hadn't been responded to coming through to us in writing as he offered, because I think we can all see Ms. Masomboga, but we can't hear her. And I can see that she's trying to talk to us, but we cannot hear her at all, literally. So we will take that offer and profusely thank the Department of Monitoring and Evaluation. We hear that there were people that were supposed to have joined us, but could not due to other commitments. But in any case, we got the presentation, and we thank DPME for coming through, those that could, and presenting to the portfolio committee. So I think, because I don't see any other hand from the members, I think we are in a position now to release the Department of Monitoring, Planning, Monitoring and Evaluation after a presentation that they've made to us, which we now thank you so much for. And those questions that Ms. Masomboga could not respond to because we simply cannot hear her. So if you could please just jot them down and send them to our secretary, who will then share them with the members accordingly. So thank you so much for your coming through. Honorable members,
thank you,
Chair. I heard people talking. I don't know who was that. You can raise your hand again. I think they were leaving. They were thanking us and leaving. Okay. Sorry about that, honorable members. And now we are left with the Department of Social Development, whom I would like to welcome and greet again warmly, and say that we will now be getting the briefing on the progress that has been made on the drafting of the Children's Amendment Bill, Bill 18 of 2020. I saw that the DG is among us, so I will hand over to him. Over to you, DG.
Thank you very much, Honorable Chairperson, and the honorable members in the committee. And thank you very much for bringing the DPME on that issue that we have. I think we will have a discussion at the other time in terms of what need to happen. We here to provide you with the Children's Amendment Bill, and I need also maybe to provide our apologies of the minister and the DM who are engaged this morning. So I will lead the team that will take us through. I am with my entities that are here also. But I will now take this opportunity to request the Advocate Mchochisi to lead us in the presentation on the progress that we have made on the Children's Amendment Bill 18 of 2020 as we come to, we're thinking as we're coming to its finality in its format. Thank you very much. Let me hand over to Advocate Luyanda Mchochisi to take us through. The presentation is presented now. Over to Mchochisi. You must unmute Mchochisi. Unmute yourself, go back to the first slide. Luyanda, you are co-hosting and unmute.
Okay, and my apologies for that, DG. Yeah, it's the technology on my side.
Start from the first.
Good morning, Honorable. Good morning, Honorable Chair, honorable members, staff of Parliament, the executive of the department and the entities and colleagues. The purpose of this presentation, Honorable Chair and honorable members, is to provide progress made on the Children's Amendment Bill 2025. We must take into account, as a disclaimer, Honorable Chair, this presentation does not seek to repeat what was presented previously, because it's just an update presentation in terms of what has transpired since we last presented. So the issue, for an example, of the VJV matter is not included in this presentation, simply because we addressed that in the previous presentation, that this bill includes the amendment as articulated in the judgment regarding the VJV case. Because when this bill was presented in 2020, it already contained an amendment to Section 40 of the Children's Act relating to the issue that was raised in the VJV matter. So the issue of the amendment, as in the case of the VJV matter, was actually there even before the matter was in court. So the department had already taken a decision to amend Section 40 to read, to include a permanent life partner over and above the spouse. I just wanted to make that clarity before I proceed. So since we presented last time, In compliance with the cabinet requirements, we consulted with the relevant stakeholders to provide inputs on the revised bill. We say revised bill, taking into account that there were new issues that we incorporated since we presented the previous bill in 2020. So the stakeholders that were approached and consulted include the relevant national departments, the national agencies, provincial departments of social development, academic institutions, the relevant Chapter 9 institutions, child protection organizations, international agencies, and members of the National Child Care and Protection Forum, as contemplated in Section 5 of the Children's Act. So the stakeholder inputs were considered, and those that were relevant were incorporated into the bill. The other comments that we received were actually a repetition in the sense that the bill was gazetted some years ago and comments were made. So the similar comments were received when the bill was circulated for comments by the stakeholders. So we took that into account. So the minister has actually granted an approval for the bill to be submitted to cabinet for approval to solicit public comments, which is the stage we are moving towards. So soon after the minister granted the approval, the bill was presented to the technical committee of the social protection cluster, that is the TWG, on the 11th of February 2025, which actually gave the department a go-ahead to present the bill to the social protection cluster, which is the DG cluster, on the 26th of February. That has also taken place. So the presented to the JCPS cluster because of some issues that are cross-cutting, which require the attention of the Department of Justice. So on the 20th of March, the bill was presented to the JCPS cluster, first to the technical committee thereof, which is known as DevCom, and the DevCom made some recommendations and requested that the department revise the bill before presenting it to the JCPS cluster. And the department did exactly that, entertained the comments, screened them, and reworked the bill as advised by the technical committee to the JCPS cluster. And the proposals, as they have been addressed, we then proceeded to the JCPS cluster on the 3rd of June, that is just about last week. And the JCPS cluster gave the department the go-ahead, and the bill now will be presented to the cabinet for approval to publish it in the Gazette in June, for ensuring that, the bill is gazetted to solicit public comments, as we have been requesting the minister to do so. So that is the stage in which we are now. We are waiting for that cabinet cabinet meeting to approve that the bill be published for public comments. And we are actually expecting to go to the next cabinet meeting if they grant us the space to present, that is in the coming meeting for the cabinet. So the presentation of the bill to cabinet for approval for public comments, which will be taking, we pray that we get to have the space still in June. So once the cabinet approves that the bill be published in the Gazette, the bill will be published for comments for a period of 30 days. And we are hoping that that will be the month of July. We must also take into account, Honorable Chair and Honorable Members, that this is just tentative in anticipation that the cabinet will approve as we pray for. So during the month of August, the department will work on the incorporation of those public comments as they may have been received during the month of July, and resubmit the bill to the Office of the Chief State Law Advisor for recertification, just to give us a go-ahead to say the bill still complies with the law and the Constitution under general after having incorporated the public comments. So once that is done, the bill will thereafter be submitted to the DG clusters in order for the DGs to give us a go-ahead to submit to Cabinet for approval to introduce to Parliament. And we are anticipating that this may happen sometime during the month of September, October. And as I indicated earlier, this is tentative, Honorable Chair and Honorable Members, depending on whether we've got a smooth sailing throughout the period. There are no hindrances in terms of the priorities of government and all that. I must also take into account, Honorable Chair and Honorable Members, that the VJV matter that I made mention of in the introduction indicated that if by the end of June the bill has not been introduced in Parliament for the purposes of amending the Act as contemplated in that judgment, the Children's Act will be read as if the judgment is part of the Act. So there is no train smash, in other words, if we have not reintroduced or introduced the bill yet, because the judgment itself makes it possible for a reading in case the bill has not been introduced in Parliament. So with effect from, say, 1st of July, the bill or the Children's Act will be read in as if the word spouse in Section 40 of the Children's Act includes a permanent partner. Thank you very much, Honorable Chair and Honorable Members.
Thank you very much, Advocate, and back to you, Chairperson. This is the progress update on the Children's Amendments Bill that is going to Cabinet this month. Thank you very much.
Thank you, Advocate Mchochisa, and thank you, DG, for this progress. It is indeed progress. And I also want to appreciate the note about the JVJ, is it JVJ or VJV case, and the implications of this progress on that ruling. I just want to now ask that the members comment on this progress that we have received, which we appreciate. I do appreciate it, but the members will be the ones that will articulate that appreciation further. The Honorable Munyai is going to start, and then Honorable Abrams, and then Honorable Mahato. And that's it. And those are the three hands that I have in this regard. Oh, and Honorable Mare. And that's it. Over to you, Honorable Mnyai.
Thank you, Honorable Chair. I wanted to raise my hand. I was kicked out. I had to come back again. Firstly, let's welcome the update from the department, which is pleasing in this regard. And I know that the department has updated us already on the basic income social protection or services, or which are called the BIG, and now they're updating us about this bill. We're very excited about this progress in this regard with respect to Children Amendment Bill. So I think what we need to do is to wait for the process, and accordingly, when the process has been concluded, the bill will be with us before, of course, through the Office of the Speaker, then subsequently to ourselves, so that we can undertake public participation. One, I think I was very arising from yesterday's joint meeting. I think one is better now clarified. It's now better clarified. One, with respect to the custodianship of the social department, because this covers broadly the child protection, foster care, adoption, child welfare, not just education. And one is further clarified that the matter that relate to the ECD was on Chapter 5, which then subsequently has been transferred to the education, which means we are very happy about the update. And the other key issue is that the education or basic education will deal with the matters Chapter 5 that relate to early childhood development section, which already has been transferred. So we're very happy for the progress that the department has made thus far. But whilst we wait for the actual moment, I will propose, Chair, that a consideration need to be made, perhaps to have an international experience on the other countries that have undertaken the similar bill by portfolio committee. And I'm sure you may have to begin through your office to have some research, which one could be the possible best practice, such that when that moment arises that the bill become before us, we can be able to make sure that we are well prepared. We have really an international experience in this regard. So we are able to address all the issues that will arise from the bill. Lastly, I must thank the department for ultimate progress that they have achieved thus far in taking forward the bill. Thank you, Chair.
Thank you, Honorable Munyai, and I note your recommendation, which I think once we sit and do our internal business, we can pursue further in committee, so that we can edify one another on what the best way of going forward should be. But thank you for that. I am now going to ask the Honorable Abrams to take over. Over to you, ma'am.
Thank you, Chairperson, and also thank you for the presentation. It was very straightforward in terms of the provisional timeline. My concern, Chairperson, might not be for DSD, but rather for Parliament, in which case, maybe this committee should, I don't know, flag it, or it's just a concern of mine, in that it would seem that DBE's amendment bill is running almost at a similar timeline to the department's amendment bill. And if my understanding is correct, both will have to go out, for public comment and public hearings as well. Perhaps, if DSD does not have to do public hearings, then my comment is null and void. But if we do, then I do think it's important, Chairperson, that, the members of the public at these hearings are, given enough time and clarity that there are two different children amendment bills that's been undertaken. Because, as we see time and time again during these public hearings, most of the public only gets the information at the door when they arrive. And then it would be a complete disservice to both bills if, individuals get confused between the two, and therefore we hear public hearing, we get public inputs once again on ECD matters, and maybe vice versa when it comes to the two departments and the two amendment bills. So that's just a concern I have looking at the timelines, of both departments. Then, Chairperson, my second point is just to abuse the platform and the fact that the DG is here in saying that I had submitted unanswered questions from last week, and I still have not received a response from the department and the entities. And to say that some of the questions were very straightforward. I mean, asking for a physical address for the SASSA call center shouldn't take a whole week to receive. So that's just to note that. Thank you, Chairperson.
Thank you, Honorable Abrams. These days, you really are getting addicted to abusing platforms, but I guess that's what politics is about. And I believe the DG and his management are noting your question, which as you say, can be actually responded as soon as possible. And so we go on to the Honorable Makgato.
Thank you very much, Chairperson. Let me welcome the report and greet everybody in the platform. I think the presentation is very much clear. So my note here is just that we must note the report as this portfolio committee. So the Children Amendment Bill 2025, I think is straightforward. If they can just check all the questions asked and try to put it in the way that it can be fine. But on my understand, I note the report. I think the progress is very much important to us. Even in future, they must come and give us a report. Thank you very much.
Thank you, Honorable Makgato, for those comments and for welcoming the progress that the department has made. I just wanted to find out before I get to the Honorable Mare, if we do have a parliamentary legal advice on the platform. I know that they may not have needed to be here, but if they are here, that will be great, because then they can just clarify the point that was made. That was the query that was given by the Honorable Abrams in terms of the DPME section of the Children's Amendment Bill and the other one. What are the implications in terms of the public hearings side of things? But if they are not here, then we will get the information from the DG or even from the advocate in Churchisa. I just thought that because your concern, Honorable Abrams, was more on the side or the legislative side of things. But over to you, Honorable Mare.
Thank you so much again, Chairperson, and thank you for this presentation. Chairperson, I was going to ask exactly the same question about the public hearings and public participations, but I also would like to know is that if the thing of the Fathers for Justice, Justice for Fathers, something like what the name is, some of their things, has it been incorporated? Are they looking at it? Because we do get a lot of emails from them to ask what is going on with their proposals. Thank you so much, Chairperson.
Thank you, Honorable Mare, and for your questions and for that seeking of clarity on the issue of the Fathers for Justice. I do not see any other hand from the honorable members, and so I will hand over to the DG and the team for responses. Over to you, DG.
Thank you very much, Honorable Chairperson and Honorable members for the questions. I think the technical questions that deals with the bill itself, I will request Advocate Mchochisa to respond. Then I will come back with other issues. I think there are a few other issues that we need to respond to. Advocate, those few questions.
Thank you, DG, and thank you, Honorable Chair and Honorable members for the questions and the comments that we have actually noted. With regard to the issue of the bill competing with the other bill from the Department of Basic Education, that is actually normal. We usually take them as the second, third, fourth, fifth or amendment bill, something like that. If there are a number of bills dealing with the same issue during the same year. So the other one, depending on which one comes first before Parliament, the other one will be Children's Amendment Bill, and the other one will be the Children's Second Amendment Bill. And then they will be processed as such. So basically, that is the issue with regard to that. With regard to the issue Honorable Murray has raised around the incorporation of comments, yes, the comments from the Department of Justice have been taken into account, but we must also be mindful, honorable members, that not every comment makes it to the bill. It depends on what the comment is saying and what are the other existing pieces of legislation, because the matter that may be commented on may already be covered by other pieces of legislation or something like that. So that's how we look at the comments and screen them. For an example, if one would make a comment about issues of custody of children as one of the issues that may have emanated from members, which impacts from justice, that is, impacts on the Department of Justice, we usually maybe give a response that says that matter is a matter that can only be determined by the courts as to who must have custody of children during a divorce or something like that. It's not a matter that we can put in legislation and say when partners divorce, children must be under the custody of the father or of the mother. It would be not advisable to deal with that, because the courts must determine, looking at many other issues before that can be determined. I'm just making an example of how we look at the comments. So the comments from the Department of Justice have actually been taken into account. Thank you on my side.
Thank you very much, Advocate, for that. The other matter, I think we need to apologize to the honorable member. The questions have been compiled. Even the answers have compiled, but there will be some delays. So what we will do is that even when we haven't completed some of the things that need us to go deeper, we will send the easy questions out to answers to the easy questions answers to the members, and I think we apologize. We will deal with that. With regard to the issue of the Parliament, I think you have responded to say that I think the legislative forming in government is very winded. It takes long up and down, that I think you need to follow up and make sure that you are on board from the business side and from the legal side, and especially to be worse when we do comments, that you need to be there to make sure that all the comments are included into the bill. Let me appreciate Honorable Chairperson for keeping us on our toes. I think it's very good. We like that, and every time we come here, we get one or two things that we need to correct, we need to change, and we need to refocus ourselves to address the plight of our citizens. Thank you very much, Chairperson.
Thank you, DG and Advocate Mchochisa, for the presentation and for having fielded the questions that were posed and comments, rather, that were posed by honorable members. And we appreciate your, I think we accept your apology and look forward to the actions that you have undertaken to take to respond to the question of the honorable member. So I think this brings us to the end of this part of the meeting, where we thank profusely the department and for having come through and for having made the presentation that has been made, and also the fact that we are where we are now with this bill, the Children's Amendment Bill. It actually shows that there has been some action, and I have to only echo what the DG has said, that processes, we get frustrated on the side of the legislature about, why are things taking so long? But when one listens to processes that cannot be bypassed, because that's what makes checks and balances to happen, so that by the time a bill is put before the president for it to become law, it has ticked all the boxes, but also that all the consultations that need to take place have happened. And one has to just only appreciate how the department is working on this, and making sure that all these stakeholders that need to be appraised of what they are doing in terms of this bill have been and seem to still continue to be consulted. So we thank you for that. And DG and your team, thank you so much. We will see you at the next meeting. And I would just ask very humbly the honorable members to stay behind for the internal business. But other than that, please travel safely, although you may have not traveled because the meeting was virtual. But all the best until we see each other again. Thank you and God bless.
Thank you very much.
Thank you, Honorable
Thank
Chair,
you very much,
honorable members. Bye-bye.
Honorable members, we are now getting into what is noted in our agenda as internal business. Just before we start, I would like to propose an amendment. I know that this agenda was adopted as is, but I was reminded of the fact that our content advisor is not with us. She's been booked off because of her child not being well. So as the person that is in charge of taking over the content side of our report, I would like for us to defer this report until the next meeting. We will try and make sure that we make time for this so that it is done still within time. In terms of the processes, the way that procedurally how it should be done. So if I can have your yay on that, honorable members.
Support, Chairperson.
Okay, thank you. I take it that that is the case for all the members. I see that the Honorable Ramaila is with us. You are
Yeah.
welcome, Honorable Ramaila. If I didn't see you earlier on, and I see that the Honorable Msweni is also with us. And now let me check very nicely so that I don't leave any other member who's joined us during the process. So you are welcome, members, in this meeting. Now, just before we go to the consideration of these two sets of minutes, I would like to give this time to two things. The first thing being issues, rather. The first issue being that I just would like members to bear with me, in fact, on this. The fact that we had discussed using the questioning time, you may have thought, what happened now? Why are we just doing the same old, same old? I would like for us to give this time and implement this type of Q&A in the new term. And I'm saying this because we are about to have our BRRRs and things like that. And I would hate for us to pilot our new way in a situation like that. And the second thing, I would like for us to discuss what the Honorable Munyai said in the open meeting about doing research and embarking on a best practice international tour. Now, here is, I did not expect this point to be raised, but we have to deal with it because an honorable member has raised it. I know that we've had very informal, highly informal discussions about it with the Honorable Mnyai and other members of the committee. But here's my take. I thought that we would wait until the bill lands on our desks, or it lands in this before this committee, so that we know which issues we would like to get a sort of best practice on, having seen which issues are the ones that think, no, guys, we have to actually get best practice on this. And so that is the one thing. And of course, the honorable member has said that we should be doing that now. And I just would like some very brief discussion on that, because I think that is something we can discuss and very dispense with it as quickly as possible. Honorable Munyai.
Honorable Chair, my experience is that this is my practical experience. Sorry, is that when the to the portfolio committee, immediately we must develop a program and consultation program and embark on that issues. And what I experience is that once the bill lands before the portfolio committee, no one is allowed to travel around that bill. It's not allowed, because you'll be eating on the period for consultative participatory democracy or the consultative process. That I know from the health experience, because the NHI bill landed. When it landed before us, when we wanted to undertake a trip to go and draw some experience, it was rejected because the bill is already before ourselves. And it was advised that we're supposed to undertake that process before actually the bill landed before us. Because broadly, it's about exchange. What are the key issues from what inconclusive bill it's all about? So that's what it's experience. I thought it's very imperative to share respectfully, but it's for the chair to further consider. Thank you.
Thank you, Honorable Munyai. I will respond with a counter experience, but obviously the members will obviously also deliberate on this, and we can arrive at a because I don't think there's a question about the need of best practice, but I guess in this case it's just the timing in the actual processing of the bill, which can be appreciated. Honorable Honorable Abrams.
Thank you, Chairperson. Well, Chairperson, I have no experience in any of it. So I'll also learn from your experience when it comes to whether you can undertake oversight, while the bill is currently, in Parliament and introduced and so forth and so on. But but my comments would be, Chairperson, that, we have the fortunate thing that, our committee team, the staff, they have now been on the Social Development Committee, for much longer than some of us. And they have probably seen many more versions of the Children Amendment Bill than what some of us may have seen. And, if I'm just using my limited experience from last term, there was a number of issues that came up there that, we already said at the beginning of, this committee, this term, that, we would like to see in the bill, the new amendment bill. And, just from some of the interactions with the department, it doesn't really seem like they are including all of our, our areas in the bill. So mine is to say that I do think that there is room. I know the chairperson's proposed that, we wait for the bill to come to the committee, but I do think there can be some preparation for an oversight, in that if the committee staff can maybe put together one or two proposals, what's the word I'm looking for, forecasting or having some foresight into what the department, just in terms of what they've been telling us, that's going to be in the bill. So I do think that there can be some proposals and some considerations in terms of, where to go and what to do, that we can consider before even the bill lands, just so that there's enough time for planning and enough time for, all those long things, approvals and so forth, that takes some time. So that would just be my input, Chair.
Okay. Thank you, Honorable Abrams. I see that Honorable Makhato, did you want to say something? I saw you unmuted and muted and unmuted. Did I miss your hand by any in any way? Honorable Makhato? Okay, I think I didn't see what I think I saw.
I'm fine, Chairperson.
You are fine?
Yes.
Okay. All right. You mentioned, Honorable Abrams, the solid experience of our parliamentary professionals and support. I see the Portfolio Committee on Social Development hand is up. Go ahead. Is this Lindiwe?
Yes, Chair.
Okay.
Thank you very much. I don't know that, Chair, I can make my comment, try to guide the committee on the matter due to experience. Chair, when it comes to international study tours, I think it is important when we submit an application to the House Chairperson, there should be a referral on that particular bill with the name of the bill and the objective of the bill. So I would advise the committee to take the route of awaiting for the referral on the bill, or if maybe the minister can maybe try to introduce the bill as the Joint Rule 159, whereby the department is just briefing the committee just for information purposes, whilst they are busy with that process. If maybe the department can try to, maybe if possible, they can explore that avenue. But it's important that we know exactly which clauses the department wants to amend, and then the committee can have the first engagement with the department to get more clarity and satisfy itself on the matters, or also get the information from the public. So maybe if the committee can just try to maybe the researcher and the coded advisor from the past experience of clauses can just conduct a preliminary research of which countries, but I would advise the committee to wait for the referral so that we can have a formal referral and we know exactly what areas the department intends to amend. So I just wanted to provide that experience as well. Chair, for the Older Persons Bill, the committee only undertook the study tour after the public hearing. So it's also doable, the committee to conduct the public participation in the country and to hear what are the issues from the public, and then they can go to abroad to get the international experience. So that happened before. That has happened before. Thanks very much.
Thank you, Lindwe, for that. That was what I was going to share with the colleagues in terms of previous experience on this portfolio committee, in terms of when a best practice tour can be undertaken, because then it would have the comments of the public, and also that would solidify our referral when we do an application. But I don't get married to these things. I want to learn from honorable members, and even as you have now given us this joint rule 159 that I had completely forgotten about, and so that helps a lot. But I just want to make sure. Oh yeah, Honorable Munyai, you are on the floor.
Chairperson, today is the 11th and the time is 11:05. My last parting shot, don't say I told you so. Thank you very much. That's my parting shot.
Okay, that's a very scary parting shot. It is laced with some threats in it, but it is taken nonetheless. It's a very, very strong parting shot, as can be expected from an honorable member like the honorable member Munyai, but we take it. And I think the information that has been shared now is going to really make sure that we do what we have to do, and in taking into consideration what members have raised. So, honorable members, thank you for that, for giving time to that. I just would like now to take us very quickly to the minutes that we are going to be considering for adoption. The minutes of the 21st, please, Lindiwe. Honorable Mnyai.
Sorry, Lindiwe. Sorry, Chair. There was a letter that was written to you and copied all of us about something, Universal Basic Coalition and so on.
Oh, yes.
Can we please, in the next meeting, it be placed on the agenda for engagement?
Yes, let's do that. We need to do that.
Thank you. And I move for the adoption of the minutes, please.
Okay, I know when there's a budget meeting happening, you just want to be out of this portfolio committee as soon as possible, Honorable Mnyai. Lindiwe, please let us have the minutes for the Honorable Mnyai to at least adopt minutes that we have before us.
Okay, Chair.
Okay.
Chair, can you see them?
Yes.
21 May, we received a briefing.
Yes.
Yeah, briefing from NDA Chair, and also adopted two sets of minutes, 22nd and 23rd Members present, Member Munyai, Mhlong, Mahato, and Ramayila, Masango, as Chairperson, Abrams, Mare, Tafeni, Reverend Kobaza, Member Mchweni, and then apologies from my member Tahotin, who joined the meeting later, Chair. Page 1, page 2 is the department chair, and then you've made the opening remarks and apologies, and I was not also present on that meeting. I was on study leave, and then also Sia was not present, our researcher, due to an urgent family matter, Chair. Minutes were adopted, agenda was adopted by Member Munyai, seconded by Member Abrahams, and then we receive remarks from the Minister, Chair. And then I'll go to page 4, and then also the chairperson of NTA also made her opening remarks, Umama Upengu, Chair, and also we received a briefing which was led by Utelezi as the acting CEO, Chair, and then we deliberated, and the NTA responded. And then you also express a word of gratitude for the work of NTA, and we thank everyone.
Okay, so Honorable Mnyai, you had pre-adopted these minutes. Is that what your hand is up for? Okay, Honorable Mnyai, I think that is an old.
Yes.
Okay, all right.
I'll move for that.
Can we have a seconder, please, for the set of minutes of the 21st of May? Honorable members. Does no one want to adopt this second the adoption of this minute?
Chair.
Okay, all right. Thank you for that. So the minutes of the 21st of May 2025 have been adopted and without any amendments. Thanks, Lindiwe. For the 28th of May.
Thank you, Chair. The 28th of May, there was a meeting to deliberate on the concurrence on in the Older Persons Amendment Bill, Chair. We also considered a report and also 2 reports, which is the report from the Older Persons Bill and also a report on the petition by Mr. Isaac, and also there were minutes scheduled for adoption. Chair, members that were present on that meeting, Member Mahato, Member Munyai, Member Rabalia, Member Mhlongo, Member Tlong, Member Masango, Abrahams, Member Mchweni, Mare, Member Tafeni, Member Tahodin, and then Member Reverend Kobaza, Chair, was out of the country, and there was an apology. Your full staff was in attendance, Chair. You've made opening remarks, and then the Reverend Kobaza's apology was noted. Minutes were adopted, moved by Member Munyai, adopted by seconded by Member Mokato. Chair, you adopted 1, 2, 3, 4, 5 minutes, 22nd, 23rd, 7th, 14th, and 16th of May, Chair. And then you've also considered the report on the Older Persons Amendment Bill, the concurrence report, which was moved by Member Munyai and seconded by Member Mokato. And then there was also a report on the petition by Mr. Isaac, calling for an increase in the old age grant. That report, Member Munyai moved for adoption and seconded by Member Abraham's, Chair. We deliberated on the Older Persons Bill, and then the members you all agree on the proposed amendments, Chair. Member Munyai moved for the adoption of the amendments, and this motion was seconded by Member Mokato. There were resolutions taken on this meeting. The committee resolved proposed that the chairperson to consider the possibility of it adopting a triangulation questioning method. The chairperson indicated that she would view the proceedings of the parliamentary committees that were implementing this approach. She would also consult with the committee secretariat and revert back to the committee. And Mr. Isaac to be invited to attend the budget vote debate so that his proactive role in society can be acknowledged. And the last one, the updated tracking resolution, mechanism to be presented to the committee at the next meeting. I think it was presented in the last meeting, Chair. So those are the short meetings, minutes of that meeting, Chair. And I call upon for the adoption through you, Chair.
Thank you so much, Lindiwe. Honorable members, those are the minutes of the 28th of May. I see that the Honorable Makato's hand is up already. Honorable Makato.
Thank you very much. I adopt the minutes of that day. Thank you very much.
Thank you, Honorable Makato. Is Honorable Makato's adoption seconded by any other member?
Honorable Mnyai, second. Thank you.
Honorable Mnyai himself seconds the adoption of the minutes of the 28th of May, 2025. Honorable members, I have to thank you so much for your attention and your participation in this meeting since 9 o'clock this morning. And if there's nothing else that is burning from the members for this internal business meeting, I would like to thank you and
apologies, Chairperson. I'm so sorry.
Okay.
I'm so sorry to do this. I completely forgot, Chairperson, to maybe ask if Lindiwe has confirmed whether Wednesday's meeting with the department will then be just any changes, or will we be having a full day of APP considering we did it again? And therefore, if it is just an abbreviated version, will then the NDA sit at the same time? And I'm only asking because I have a clash on Friday, so I just want to get clarity if there is clarity on it yet. Thank you, Chairperson. Apologies once again.
Not a problem. Lindiwe, are you able to respond to that?
Yes, Chair.
Mm-hmm.
Yes,
Go
Chair.
ahead.
Yes, Chair. The meeting for the revised APP will take place only on Wednesday. The reason being, I had a discussion with the DG Chair to check whether there will be a full presentation because they came before the committee to brief it on the APP. And he mentioned that there will be a short briefing. They will just highlight the areas where there are revisions. So, Chair, there will be SASA. They will highlight the revisions of the APP and then DSD, but the NDA did not appear before the committee. They will present their full APP and strat plan, Chair. I think that's for next week, we'll be Wednesday for the whole day.
Okay. Thank you, Lindiwe. Honorable Abrams, there is your answer and there is your thumbs up. And I think this also just must be noted, I think, by the honorable members that we have a full day meeting on Wednesday. It is a committee week, I believe, and so please come through prepared for a full day meeting. With that being said, I want to thank you again and declare this very short meeting with gratitude, declare this meeting adjourned. Thank you so much, honorable members. God bless.
Thank you, Chair. God bless too.
Thank you, Chair.
I will end the meeting for everyone. Thank you very much, members. See you next week.
Thank you. Thank you, sis. Thank you so much.
Process on.